Are you allergic to any medications?
In the emergency room, not knowing a patient's health history can mean trouble. Unnecessary tests, wrong medications, loss of valuable time. But imagine this. What if you could go any place in the country and know that your entire medical record would be readily available when it was needed?
Getting good healthcare is all about having good information on which to base treatment decisions. And health information technology moves information on healthcare more easily, faster, and more accurately.
Right now, a movement is underway in all the 50 states and U.S. territories to make this happen.
And 70% of Americans don't even know this National Health Information Network is being built. This is a sea change for people. This is just a really huge change, and nobody knows about it.
We like to think about this as having a national direction but local control.
They would have one place where they could theoretically store all that information and have ready access to it.
In this scenario, your medical record is a virtual one. Your doctor enters your health information into a computer database. Lab technicians, X-ray staff, and pharmacists linked to the same network can access it quickly and easily. Technology is not the main barrier to sharing health information nationwide.
When we talk to the technical folks about designing systems, their response to us is usually, tell us what you want, and we can build you a system that will do that.
The more thorny issue is how to protect that information.
When we think about how to keep electronic records more private and secure, we really are talking about sort of two distinct pieces. One is the security of the record. How do you keep people from hacking in? But it's not just about keeping the information secure. It's about who has the right to access it, use it, and for what purposes.
When you go into a doctor's office or into a hospital or any other healthcare situation, the healthcare provider is required to provide a notice of privacy practices. So they're required to inform patients how the health information about that patient may be used or disclosed. The healthcare provider can use it for treatment purposes, so they can use it to treat you, to talk to a provider that they want to refer you to talk to another colleague, to consult about your case and that sort of thing. They can also use information in order to get paid for the service they provide, so they can submit information to your insurance company. And then the third category is healthcare operations, and that's some general office activities that a healthcare provider or a doctor would need to engage in, like sending out an appointment reminder or scheduling a procedure at a hospital or a clinic for you. It would also include things like disease management programs in order to help manage a patient with a chronic condition.
We really have some critical decisions to make about just how much privacy we need in the system in order to make it work, allow people to trust it, and at the same time still allow the information to move freely. There are actually a number of different models that are popping up out there that provide different levels of patient control.
Like the other stakeholders in health information exchange, consumers and patients have their own take on who should have access to their health information.
Everything's electronic, really. I mean, bank records are all electronic, so, I mean, if I'm not worried about that, then I assume, there's ways to protect my privacy.
As far as electronic information, how can you really be sure that it's secure? I have no way of knowing that my files aren't being shared with others.
Many patients are less concerned about privacy on a day-to-day basis for most of their common issues, and they're interested in speed and convenience. But I think as a policy, we can't assume that for everyone. There at least needs to be the mechanism to have the privacy.
As the movement to a national health information exchange system continues to evolve, the dichotomy between access and privacy is being diffused by designing systems that allow for both. Your participation is important. Ask questions. Will I have access to my medical records online? How? How will my information be used, and by whom? What control will I have over what is shared? If there's a breach of confidentiality, how will I be informed?
What we're trying to do is bring the states together to look at their laws, look at their policies, and figure out how they can continue to protect consumers but still allow information to flow from one state to another in order to treat patients, provide high quality of care, and avoid medical errors.
How do we get all the benefits of health IT and at the same time allow people to trust it so they'll allow their information to be part of it?
In short, how do we do it right